So now I'm going to demonstrate 3 different tests for testing the strength around the ankle. First, I'm going to demonstrate the test for ankle dorsiflexion and inversion. And the reason I'm not testing pure dorsiflexion is because that is primarily performed by the tibialis anterior, and the tibialis anterior also contributes significantly to the dorsiflexion and inversion moment. So we're going to test that because it's the more functional movement that you're going to see with your patients. So it's very important to keep in mind with testing dorsiflexion and inversion that you've assessed the range of motion that your patient has. Normal range of motion for dorsiflexion is listed as 0 to 20 degrees, but you'll find that many people do not have 20 degrees of dorsiflexion. And so you want to make sure you're assessing their available range due to potentially tight gastrocs. So to perform this test, I'm going to ask the patient to move their foot up and in, and I may have to show them that movement, so go ahead down, and I might take them through it, up and in. Great. Then I'll have them do it on their own, and then I will apply resistance to the dorsum of the foot in a down and out towards me motion. So I'm doing it, applying resistance in both directions. Grade 5, I won't be able to break that. Grade 4, she will yield to some of that resistance. And in grade 3, she will just be able to achieve that. Anything less than that, you're just looking for the inability to complete the full range. So if they complete partial range, or you're seeing a lot of other compensatory movements, you would give them a 2. If you're not seeing hardly any movement, but you're palpating over the tibialis anterior tendon, and you feel some popping out there without a lot of movement, then you can give them a trace of the tibia anterior. So now I'm going to show you the test for more pure inversion, which is more of a down and in movement, and that is primarily performed by the tibialis posterior. And so again, you may want to take your patient through that motion a few times just to make sure. And you do want to palpate. I like to palpate for the posterior tib tendon throughout this test to make sure I'm isolating the right one. So that's behind the medial malleolus, in between that and the navicular bone. Keep in mind that normal range is about 35 degrees of inversion. And so I'll just have my patient go ahead and move your foot in and down, and I'll apply resistance in the opposite direction. That would be a 5 if she was not broken from that position. Keep in mind also as you're applying these resistance levers down at the foot that these are not the quadricep or the hip extensor muscle groups. So you're not going to be applying the same amount of force to achieve a grade 5. You want to take into consideration the mass and the size of the muscle and kind of equalize that to how much force you're giving. So a grade 4 would be her ability to achieve full inversion range, but she would yield a little bit against some resistance. A grade 3, she would just be able to hold against no resistance. And anything less than a 3, she wouldn't be able to achieve full range of motion. Again, palpating for a trace, I'm palpating for that tendon to pop out to be able to give her a trace. Now I'm going to show you the test for eversion and dorsiflexion, which is testing the peroneals, the peroneus group, peroneus longus and brevis. So again, showing your patient that this is not a very large movement. It's about 0 to 25 degrees at maximum if you're just getting pure ankle eversion. And again, palpating for the peroneal tendons behind the lateral malleolus is usually the easiest place to palpate. It's not where they insert, but it's the easiest place to palpate. So if she can achieve the full range of motion and hold against my resistance, that's a 5. A 4 would be just a yield. And then a 3 would be just the ability to get to full range but hold against no resistance. A 2, again, would just be the inability to even achieve the full range of motion. And a 1, I would really just be able to palpate that tendon popping out.